Tonight, triple therapy reduces antibiotic use in pediatric CF. Thousands of U.S. kids hospitalized for vitamin toxicity. Upadacitinib effective for severe alopecia areata. NHS rehab cuts leaving patients with avoidable disability. Vaping and cannabis hit record highs among young adults in 2025. Survey talks on launch of clinical trial of Ebola vaccine in DRC Advance. Who says Ozempic may have revealed the brain's hidden craving center. 3,500-year-old skeletons challenge what scientists thought they knew about syphilis. Scientists discover a hidden brain rhythm that could improve Parkinson's treatment, and the adult brain can repair itself better than scientists thought. We start with triple therapy reduces antibiotic use in pediatric CF. Triple therapy reduces antibiotic use in pediatric CF. TOPLINE pediatric patients with cystic fibrosis, CF, who initiated elexacaftor/tezacaftor/ivacaftor, ETI therapy experienced more than a 60% reduction in antibiotic days per year. Methodology: a single-center retrospective chart review was conducted at Nationwide Children's Hospital in Columbus, Ohio. A total of 139 pediatric patients aged 6-18 years, median age, 11 years, 99% white, 57% female, with CF who initiated ETI therapy were included. Patients served as their own controls, with antibiotic utilization compared before and after ETI initiation. Only systemic antibiotics used for respiratory infections were included. The primary outcome was antibiotic days per patient year. Secondary outcomes included changes in use of specific antibiotics, enteral versus intravenous therapy, and different antibiotic classes. Takeaway: the median antibiotic days per patient year decreased significantly from 17 days pre-ETI to 6 days post-ETI, p.001. Both intravenous and enteral antibiotic use decreased significantly after ETI initiation, p.001 for both. Use of IV vancomycin, linezolid, and tidazolid, antimethicillin-resistant Staphylococcus aureus, MRSA tetracyclines, other. Thousands of U.S. kids hospitalized for vitamin toxicity. Thousands of children have been hospitalized after poisoning by vitamins and minerals in recent years, the majority ingested intentionally, a nationwide study showed. Over just 3 years, the Federal Healthcare Cost and Utilization Project KIDS inpatient database recorded vitamin and mineral toxicity as a cause of hospitalization for 1961 children. That represented just the supplements for which there was a toxicity-related International Classification of Diseases 10 code, said Marina Maciel, MD, MPH, of Baylor College of Medicine in Houston, whose group reported the findings at the Pediatric Hospital Medicine, PHM, 2026 in Kansas City, Missouri. Our study probably only scratched the surface, she said. A 2018 study of pediatric hospital visits due to poisonings that used the same inpatient database found only 14.5% of these resulted in inpatient admission. As for the bigger picture on toxicity, the most recent annual report from the databases of poison centers across the country noted dietary supplements, herbals, and homeopathic medicines together to be one of the fastest-growing types of exposures resulting in calls. Although accounting for only 0.11% of exposures overall, sup. Upadacitinib effective for severe alopecia areata. TOPLINE upadacitinib, an oral selective JAK inhibitor, significantly improved scalp hair regrowth and quality of life versus placebo in adults and adolescents with severe alopecia areata, AA, in 2 phase 3 trials. Methodology: researchers conducted 2 parallel phase 3 randomized clinical trials, UPAA1 and UPAA2, from October 2023 to July 2025 across 25 and 28 countries, respectively, evaluating upadacitinib in patients aged 12 years to less than 64 years with severe AA. A total of 1,399 patients were randomly assigned in a 2:1 ratio to receive once daily oral upadacitinib 15 mg. 270 patients in UPAA1, 289 in UPAA2, upadacitinib 30 mg, 271 in UPAA1, 289 in UPAA2, or a matching placebo, 135 in UPAA1, 145 in UPAA2, for 24 weeks. Mean patient age was 34.9 and 36.8 years in UPAA1 and UPAA2, respectively. 57.8%, 62% were women. 55.6%, 67.6% were white. 35.2%, 24.2% were Asian, and 6.2%, 5.4% were Black individuals, respectively. The primary efficacy endpoint was achievement of a severity of alopecia tool, SALT, score less or equal to 20, less or equal to 20% scalp hair loss, at week 24. Secondary endpoints included SALT scores less or equal to 10 and 0, improvements in eyebrow and eyelash hair loss, and health-relat. NHS rehab cuts leaving patients with avoidable disability. NHS patients are facing avoidable disability and are not getting the quality of care they deserve. As NHS rehabilitation services deteriorate, physiotherapists in England have warned. A survey of physiotherapists by the Chartered Society of Physiotherapy, CSB, found that patients are waiting longer, recovering more slowly, and living with avoidable disability as a result of cuts to rehabilitation services, where recruitment has been frozen, posts deleted, and rehab space cut back. The poll of 548 NHS physiotherapists in June found that over three-quarters, 79%, were concerned that staffing levels were insufficient to meet patient need. Almost a third, 32%, said they had less face-to-face time with patients, with almost three-quarters, 74%, unable to provide the quality of rehabilitation patients needed. 1 in 5, 20%, reported that waiting times for their service had increased. Recruitment freezes were reported by 72% of physiotherapists, up from 63% in 2025, and more than a third, 37%, said posts within their service had been deleted. Almost 1 in 3, 30%, said their entire service had undergone cuts. Rehab space and equipment lost. The survey also highlighted worsening ICSI. Vaping and cannabis hit record highs among young adults in 2025. Survey: young adults, use of vapes and cannabis hit all-time highs last year, according to the results of a large new national survey conducted at the University of Michigan. The percentage of young adults who said they'd used nicotine vapes in the past 30 days reached the highest levels since the question was first added to the survey in 2017, more than tripling to 19%. For cannabis, 29% of young adults between the ages of 19 and 30 said they'd used the drug in the past 30 days, just slightly below the all-time high of 30% the previous year. A record high of 12% reported daily cannabis use. The annual Monitoring the Future survey, which is supported by the National Institutes of Health, gathers data from about 20,000 Americans spanning the ages of 19 to 65. Overall, this year's report presents a mixed picture of substance use trends in the U.S., according to Nora Volkow, director of NIH's National Institute on Drug Abuse, NIDA. It is reassuring to continue to see relatively low smoking rates and a continuing decline in alcohol use among adults, Volkow said in a press release. At the same time, rising rates of cannabis, nicotine, and certain other drug use warrant attention. Continued. Talks on launch of clinical trial of Ebola vaccine in DRC advance, WHO says. Talks are underway between authorities in the Democratic Republic of the Congo and the World Health Organization to expedite the start of a multi-armed, Phase 3 clinical trial of vaccines geared toward helping to contain the spread of the Bundibugyo virus in the northeast of the country, which the Director General of the Global Health Agency warned Wednesday is on track to become the largest Ebola outbreak on record. It's already the second biggest Ebola epidemic on record, and it's moving faster than any previous Ebola outbreak. At its current pace, it's on track to eclipse the West African Ebola outbreak of 2014-2016, Tedros Adhanom Ghebreyesus said during a news conference in Geneva. The first vaccine to be pushed into the field for study will be Merck's Ervebo, a vaccine that targets a different species of the virus, Ebola Zaire. An expert panel that advises the WHO was initially reluctant to recommend its use, but an increasing number of studies in animals and in people have persuaded it that the vaccine could offer some cross-protection against Bundibugyo and should be tested to see if it could help. WHO has recommended inclusion of the vaccine in a Phase 3 trial, which Ozempic may have revealed the brain's hidden craving center. Ozempic may have revealed the brain has hidden a craving center, a date. August 12, 2026. Source: The Conversation Summary. Ozempic-like drugs appear to weaken more than Hunjarathi may also reduce cravings for alcohol and other addictive substances. Scientists are increasingly tracing this effect to the lateral septum, a brain region that helps connect memories and surroundings with rewarding experiences. Packed with GLP-1 receptors, it may act as a crucial control point between thinking about a reward and feeling compelled to pursue it. The discovery could open new approaches to treating addiction as well as obesity. Share. For many people, the thought of a tasty burger or a cold pint of beer conjures up a vivid mental image and drives behavior. This link between thinking and doing serves a clear function. It motivates us to get the necessities for life. But for some, this process can malfunction. Preoccupation with these rewarding stimuli can lead to disorders of substance overuse, including overeating to the point of obesity and alcohol abuse. Studies going back to the 1970s have linked vivid mental imagery with drug abuse. Understanding this link between craving and 3,500-year-old skeletons challenge what scientists thought they knew about syphilis. 3,500-year-old skeletons challenge what scientists thought they knew about syphilis. Date: August 12, 2026. Source: Charles Sturt University. Summary: Ancient remains from Vietnam suggest diseases like yaws may have been passed from mother to child thousands of years ago, a form of transmission often assumed to indicate syphilis. The discovery could overturn how scientists interpret ancient infections and complicate the long-running mystery of syphilis's origins. Share. A new study led by a Charles Sturt University researcher and international colleagues is challenging a long-accepted idea about how scientists identify ancient disease. Evidence from the skeletal remains of children who lived in prehistoric Vietnam suggests that treponema diseases could have been passed from mother to child thousands of years ago. Congenital transmission has historically been viewed as a strong indicator of venereal syphilis, but the new findings suggest that other forms of treponema disease may also have spread this way. The international team from Australia and Vietnam was led by Dr. Melindri Vlock, pictured top, at left, lecturer in anatomy and physiology in the Charles Sturt School. Scientists discover a hidden brain rhythm that could improve Parkinson's treatment. Scientists discover a hidden brain rhythm that could improve Parkinson's treatment. Date: August 12, 2026. Source: University of Cologne. Summary: Scientists have pinpointed a brain network and its distinctive electrical rhythm that appears to drive the benefits of deep brain stimulation for Parkinson's disease. The discovery could lead to more precise, personalized stimulation settings and better results for patients. Share. Deep brain stimulation, DBS, can reduce movement problems caused by Parkinson's disease, and new research is providing a clearer picture of why the treatment works. Scientists have found that its benefits appear to depend on stimulating a specific brain network that communicates primarily through a relatively fast beta rhythm, 20 to 35 Hz. The findings come from an interdisciplinary group of neuroscientists and clinicians at the university hospitals of Cologne and Dusseldorf, Harvard Medical School, and Charité Berlin. Published in the journal Brain, the study, the deep brain stimulation response network in Parkinson's disease operates in the high beta band, is the first to bring together two approaches that have largely been studied separately. The adult brain can repair itself better than scientists thought. The adult brain can repair itself better than scientists thought. Scientists have discovered a remarkable hidden repair system that allows the adult brain to rebuild damaged cellular networks. Date: August 12, 2026. Source: University of Zurich. Summary: The adult brain may be far better at repairing itself than scientists once believed. In mice, researchers discovered a special group of support cells called astrocytes that respond to damaged brain tissue by rebuilding lost cellular networks. Rather than simply moving into the injured area, these cells perform a remarkable maneuver. They create new nuclei and send them traveling through long cellular extensions to repopulate damaged regions. Share. The adult brain may have a greater ability to repair itself after injury or certain autoimmune diseases than scientists previously believed. In experiments with mice, researchers at the University of Zurich found that specialized support cells can repopulate damaged parts of the brain in an unusual way. Rather than moving entire new cells into the affected area at first, they send newly formed cell nuclei there. Glial cells play essential supporting and nourishing roles in the That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.